In the United States alone, there were around 38 million adults who smoked some form of cigarettes. This is more than the population of Greece, Denmark, Portugal, and Sweden added together. Many people are switching from regular cigarettes to electronic cigarettes as a safer method for their nicotine fix. The dangerous chemicals are still present and prevalent. Cigarettes and e-cigarettes have many different chemicals such as butane, methane, cadmium, nicotine, ammonia, and arsenic. Nicotine is the addictive substance in cigarettes. Ammonia can cause airway destruction. Methane can cause rapid heartbeat. Butane causes respiratory, liver, and kidney failure. Arsenic is poisonous. We will discuss cadmium. Not only can these chemicals increase the risk of lung cancer, they also can increase the risk of ovarian cancer and other cancerous diagnoses. The simple act of lighting a cigarette or e-cigarette can cause a cascade of failures at the microscopic level. Cadmium is commonly used in rechargeable batteries and used to protect critical components of airplanes and oil rigs from corrosion. While these uses of cadmium are good for humans, however, there are some serious downfalls of using cadmium. In a normal functioning cell, estrogen needs a receptor to bind to in order for it to enter the cell. That receptor is called an estrogen receptor or an ER binding site. If a binding site is available, estrogen will enter the cell and bind to an ER site. Once it's bound, the ER will enter the nucleus through the ERK1 and 2 pathways, which can cause cell proliferation. When estrogen is not bound, the cell will only produce one new cell, but when it is bound, the cell will produce many, causing a tumor growth. When someone smokes a cigarette, cadmium enters the body through the smoke that is inhaled and passes throughout the body. Cadmium can mimic the effect of estrogen, meaning it can bind to an ER site if a site is open. When an ER binding site is open, cadmium can bind to it. However, when cadmium binds to an ER site, it increases the expression of ERs by a factor of 2. The ERs now enter the cell and again increase the amount of cell proliferation. Without cadmium, the cell will only produce one new cell before binding. But when cadmium binds to it, it causes a multitude of formation of new cells, which leads to the growth of tumors. With this newfound knowledge, do you really want to run the risk of these diseases just for a buzz? Or do you really want to do it to your family? Not only is smoking dangerous, it affects the lives of millions, including your loved ones. Now, throw away that cigarette and start your journey to a healthier life with me today.